how do you see AI in healthcare? How it's evolving overall.
Everyone is kind of trying to
Yeah.
compete over each other, and it's a very competitive space right now.
Are the agents are going to replace the doctor? Do you see that is a kind of possibility or no?
I feel there should be a model specifically for healthcare also that should
Okay.
be out in the industry.
Anything you suggest for younger generation or students where they want to get onto AI?
Healthcare costs have been growing like
Crazy.
exponentially.
Would you suggest any AI products?
Came across recently in the last 6 months is challenge
Hey Arun, thanks for stopping by, and this is Raghu Adavini from Bhairavi Podcast. We've been in this podcast sessions for last 1 year, so thanks for stopping by. Really appreciate it.
Absolutely, Raghu.
Yeah,
Thanks
great.
for having me here.
Excellent. So Arun, this is going to be very casual conversation. Is all about like we are conducting AI sessions, podcast sessions. It could be different domains, expertise, and technologies we have been inviting.
Sure.
So today our topic is more on AI in healthcare.
Absolutely.
So just want to give perspective of what we do, right? So we have a couple of companies like Asoft Consulting, we Secure Labs, Evalrite, deep digital marketing and whatnot. So we always feel like the AI year ago or a year and a half ago, like we were thinking AI is really impacting or not. Like last 18 months, we've been doing projects for companies, manufacturing and healthcare, and also insurance, and we can see a lot of potential in terms of ROI for some cases, not all the cases.
Nice.
We are doing a POCs, a proof of concept for some customers. It's like spending $1,000 getting $1, then obviously will not go ahead.
Yep.
And then spending $1,000 getting at least 20%, 30%, 40% return, then we'll we'll go ahead and then we'll get approvals from the customers. So how do you see AI in healthcare? How it's evolving overall, and then how do you see that in next 3 years, 5 years down the line?
I'll quickly start with one small statement by CEO. Very recently, the last week or two. I think Anthropic or some CEO just mentioned, whatever projects they started 2 weeks back, they're already obsolete. So it's evolving real fast.
Really fast.
Yeah,
Absolutely.
Very fast.
Yeah.
And we have seen how it is really, everyone is kind of trying to compete over each other, and it's a very competitive space right now.
Yeah.
Over 3 years, how it's gonna evolve, it's very difficult to say.
Yeah.
Because I did not anticipate how it is going to be like 3 years back.
Right.
ChatGPT started back in 22 November.
Right.
It was a fancy chatbot, but now it evolved into so much more. I've been at few conferences where AI is very well embedded in telehealth also.
Right.
So what I feel is, at least what I'm looking here, it will be more and more easier.
Yeah.
Healthcare will be more and more accessible
Right.
through AI. The only thing is there should be some guardrails that should be
Yeah, governance
created
point of view. Yeah.
from a governance point of view.
Absolutely. Yeah.
But otherwise, there is a lot of prospect. Also, they should be like the hallucination, all that aspect has to be taken into consideration.
Right.
Especially when we want to implement AI in any healthcare industries,
Right.
or any other regulated industries.
Right. So I think, as you said, the hallucination point of view, for any industry, suppose, for example, marketing material preparation or a content writing and all those stuff is all okay in terms of accuracy here and there.
Sure.
But healthcare is something where the AI agents or a Gen AI or agentic AI, when they are implementing, it has to be so accurate that you're touching the human life, and then you see the models, LLM models or AI is kind of a really mature enough to take those into considerations. It takes some more time and a couple more years to mature these models for a healthcare industry.
It obviously will take some more time. Let's look at the latest models, right? Like all the models that we have today, we talk about some models are good at image generation. Some models are good at like giving us results. Some models are good at research. Some are good at coding.
Okay.
At the same time, it all depends on how the model is being trained on, what data is being trained on, how it is tuned on. So the more the model is trained on healthcare data and healthcare information, the better model it will be. So I feel there should be a model specifically for healthcare also that should be out in the industry. Right now there is none, and everyone in the healthcare industry would really benefit from that.
Excellent. That's good. That's awesome. And also we have seen some of the customers where the AI agents are working perfectly with a good intent, whatever they implemented, and then it's giving a results. It could be finance, or it could be HR, or whatnot. So healthcare is something where, for example, if you take a group of physicians or group of people like who are in the healthcare industry, are the agents are going to replace the doctor? Do you see that as a kind of possibility, or no? Just at least suggestion point of view.
Unfortunately, I do not see that. At least from what I'm seeing, because
right.
Again, it's all experiences are human based.
Right.
So healthcare is probably the last thing which will be
touched and
which will be touched.
Yeah.
But it will assist. It
Correct.
will assist doctors. It will assist all the clinicians, all the healthcare providers, and also the patients.
Right.
AI will be helpful, but I feel that it will be a tool that we'll have with us at our dispense.
Right.
I do not expect that to really take over something.
Yeah. It's a more of a kind of a enabling and or make them efficient than getting a replaceable as such. I totally agree.
Absolutely.
I know I was talking to another attorney podcast a couple of months ago. Like I was saying, like there is a Harvey and there are a couple of products in a law firm. I asked them, like, is that going to replace attorney? They were saying that it's not going to replace attorneys as such, but it definitely enables. Suppose they can handle, instead of 15 cases, they can handle maybe 30-40 cases in a quarter or something like that, where they'll become more productive.
Exactly.
Than this. That's I totally agree.
Yep.
So anything you suggest for younger generation or students where they want to get onto AI and where they or AI in a healthcare point of view? We all know that technology is not going to be successful unless it marries with the domain, whether it's healthcare or logistics or manufacturing or whatever the domain is. So we need to apply the technology in domain. So in healthcare, like suppose anyone they want to get onto AI specifically for healthcare, what do you suggest, Arun?
Before I suggest, I'll say it's a good news.
Yeah.
The reason is there is so much potential. Throughout the country, there's so much talk about ensuring the cost is kept low.
Okay.
Either to keep the cost same or even to reduce it.
Right.
Healthcare costs have been growing like
crazy,
exponentially.
Absolutely.
So it has become very difficult. If I have to take any medication or a doctor visit or anything, has become so much expensive compared to 10 years back.
Right.
So for any new grad or any new engineer who is willing to come to healthcare, there's a lot to improve.
Okay.
So there's potential to show value.
Okay. Great. Excellent.
If I have to look at recent last year, White House and CMS, Center of Medicaid and Medicare Sciences Department, they've released a mandate saying prior authorization and other, we have to modernize healthcare.
Okay.
So
got it.
There is support even from the government to modernize healthcare. So there is potential. There's a lot of potential here. So much of focus also.
Absolutely.
And, brilliant opportunity. There's a gap. If you ask me, I will, whenever I look at something, I really like when there's a gap, because it helps me to really, that's the most thing that we can improve.
Right.
So,
100%.
That's
my
great feedback.
Excellent. So what are the tools, or products you would say, like, which are popular or which you suggest or you started learning, as a technologist, and what do you suggest, any AI products?
Sure. I use it. in a day-to-day basis. I use AI on a day-to-day basis at my work and at my home place also.
Okay.
Because it gets so much difficult for me to sit and type.
Yeah.
I'm wearing the Meta Ray-Bans right now.
Great. Excellent.
So
I can see that actually.
Yeah, I use AI on that. I usually open ChatGPT in voice mode. I have interaction with ChatGPT for an hour or so.
Okay.
So keep on asking questions and correct me.
Correct.
And there's one aspect I really liked, which I came across recently in the last 6 months, is challenge AI. Unless we challenge AI, we don't get the best output.
Absolutely.
So I keep challenging it. I keep saying, "Are you sure? Are you?" I want it to be blunt with me. Sometimes it's too soft.
Too nice, and then too
Exactly.
absolutely.
So I use it in day-to-day basis, but mainly I interact it while I'm doing my chores or when I'm going out on a walk or something, so that it's so much easy for me. I don't have to sit at my desk and do something because I'm already preoccupied with my work.
Right.
Which I use it for any kind of admin work or paperwork that I have to do. That I use it, or any research I have to do, I use it.
Yeah.
But other than that, it's mostly in voice mode that I use AI.
Yeah, I totally agree. And also all these LLM models. I was having a podcast with Quent. Just before this one, he was talking about all these models are all please the user, right?
Exactly.
Hey, can I do this? And they'll say, of course, yes. They'll say that. So I totally agree. Then we need to be blunt and we need to say that, can you suggest a practical approach and whatnot, right? So really good. And also we are doing a AI property management platform called letquickly.ai.
Okay.
So what it does is it's an AI agents called Lekha. Let quickly, and then these agents will coordinate with the tenants and property manager and landlords, and then any for rent collections or tenant issues, they'll coordinate with the maintenance people and create the records and tickets, and then assign respect to technician and coordinate the timings, availability, all the stuff. The reason is I was saying is we were thinking what are the real use cases. I've seen a couple of friends and customers where they were saying they were able to do it, but the headache is coordination and triaging and whatnot. Right, this headache we are able to resolve the issues for the customers. We are launching around March 1st. So and already we have some other customers lined up in the waiting list.
Okay.
So we are going to do that.
That's good.
And then in the healthcare industry also, similar problem is where customers calls and then getting appointments is always a crazy. Suppose if we are getting the doctor appointment, whatnot, suppose if we call around 7 o'clock, 8 o'clock, or then already out of office, so it'll go to answering machine. And then so do you see that the AI receptionist is one of the top job or top agent across the globe? That's what I can see. Do you see that that's going to be prominent to take the appointments and booking the appointments with the doctors or physicians is going to be rapidly going to change, and then make people get the appointments earlier, sooner, and make the doctors also productive with the agents, number of cases, whatever they can resolve, more. And what's your thought process in that, Arun?
Certainly. One aspect is if I have to call a doctor's office, probably I'm put on hold for 20 minutes, 15 minutes.
Yeah.
That can be easily avoided.
Absolutely.
We can be more efficient with our time.
Right.
This is our time, and also probably if only thing is it has to be mature, whatever AI platform that is going to manage this. It can at least start with some basic functionality like scheduling appointment or rescheduling appointment and such.
Right.
And then probably add more features to it.
Yeah.
But absolutely. There's a lot of potential there. I mean, but when scheduling that appointments, there is this aspect that comes into picture, especially for healthcare, is called PHI.
Yeah.
Protected healthcare information.
Correct.
Which has to be protected. So when we are sharing that information, that trust has to be built in the whole ecosystem, saying whatever information you're sharing with the AI, it will not be used for any training purposes, or it will not be saved elsewhere. So these are some of the like we discussed, right?
Yeah,
the
absolutely.
guardrails have to be put.
Guardrails and governance and need to be there. Yeah.
Exactly.
Yeah.
Exactly.
Yeah.
So,
And any organization like small business like us, we are focusing on different industries.
yep.
So if we need to get onto healthcare domain with the AI, so how do you suggest where we need to start?
I would say start with some proof of concept.
Okay.
Have a product available
Okay.
if they're exploring options, because it's a very, like I said, very regulated industry, but there are different aspects. If anyone is thinking about adding, like involving themselves into providing solutions within healthcare, unwrap what happens from calling the doctor's office till taking the appointment, follow up, then going out of the doctor's office, taking the prescription and going back home and getting treated, and then follow up. So this whole cycle, if you unwrap it, there are various touch points, and each touch point, obviously multiple touch points have gaps today. That gaps, if we analyze it, where the gaps are, maybe inquire with more and more healthcare professionals, where the gaps are, where they can be helpful. That's when we can tailor the product to that specific needs, which will help in resolving that issue. Then we can expand our portfolio. That is how I would approach.
Excellent. That's good. So switching gears here, and now you are into technology too. So previously you have some experience on DevOps and CI/CD and all.
Sure.
So being in an AI era, all these kind of some space like DevOps, CI/CD, humanly, they were doing, and controlling the pipe, and then which versions to be pushed to the production, whatnot. Do you think these are all going to be replaced with AI agents?
Replaced? Yes, probably. It's going to take time. But I would say before replacing, they would evolve.
Okay.
All the current tooling will evolve very fast, and they will probably be more intuitive and easier for us to use than clicking some buttons or running some scripts or something like that. It could be tailored in much better ways. So that's what I would expect. Any tool, especially coming into the platform engineering or DevOps space, certainly. There are already some tools which are proclaiming to do that today. They're seeing they have the AI capabilities to run some tests, some smart tests, whatnot, and make sure the application can be deployed with ease into production, can be shipped faster. It will take a little more time. I think right now the immediate areas of immediate beneficiaries are developers who are able to rapidly develop.
Got it. Yeah, absolutely. Got it. Very good, Arun. So anything you see the top 3 challenges in AI area, or at least top 1 or 2 you feel on top of your head? What are the challenges in AI apart from AI governance, AI guardrails? Anything you can think of?
There's a lot of fluff. I mean, if I look for any AI product, there are so many options here. It's very hard to decide which one is it that we should go for. With everything evolving so fast, and which one to prefer. So it'll take some time to choose and refine whatever AI solution we choose or AI implementation we do. It has to be tested through time.
Got it.
So that's one challenge. Unfortunately, before that's the challenge. The time is a challenge because everything is evolving so fast. It's making it so difficult.
Absolutely.
I'm sure there will be one point where we will kind of everything will at least flatten out for some time, or at least slow down a little bit, where we can really see the ROI of currently that's the challenge.
That's the challenge.
Everyone is talking about ROI.
Absolutely. Even the stocks are all falling apart, and one of the reasons is they're saying there's no ROI on AI, right? So yeah, absolutely, I totally agree. And then so anyone want to get onto AI? Suppose the person is having 15 years experience, 12 years experience in technology. but they don't have any AA exposure, where they can start with and how they can kickstart their career. As you suggested for younger generation, you said like we need to get onto the products and then do it. But for experienced people, what's your suggestion?
There are different approaches to take here. One is an individual should be personally motivated,
right,
to keep themselves upskilled. And the second thing is find opportunities.
Okay.
Obviously at work, whatever they're doing, find opportunities, because the most boring work will be the most there'll be more fruit there, there'll be
absolutely
more room for improvement there.
Yeah.
So identify that, and also take help from your management.
Okay. Right.
For example, today I run a weekly AI enablement officers. So,
excellent. That's great.
So I ensure I bring in all our folks under our multiple teams together, so that we brainstorm together, we learn from each other, we share from each other. So that culture has to be there.
Yeah.
If I'm speaking to anyone who is in management or leadership level, I would say bring that, make that very intentional.
Yeah.
And make sure we are upskilling everyone to be ready for the future.
Yeah. So, absolutely. That's great. And then in our companies as well, like what we do is we want to make sure like every department we have AI enabled, like HR onboarding. We used to take like a week or so to onboard a person. Now we are doing in 24 to 48 hours, because all the offer letters will go out and then everything is taken care of. Of course, there's a human intervention, like HR will review the information, approve, and then it'll go on and send the emails and whatnot. So finance, same thing, and we are trying to find out accounts payable, receivable, like we have checks and balances we are doing, AA agents are doing. So it's pretty decent. That's good.
That's nice.
And then so you see that next era is going to be webless. Webless means like we used to have applications or ERPs and whatnot, when we need to have a humanly interact to the system, and system will need to update, and then that's the only way to interact. Now the AI agents is acting like a human, like where you want to book appointment, you could say to agent will book it. You don't need to go to the portal and book it, right? So do you see that number of applications are going to reduce because the action is going to be taken by AI agents?
Number of applicants are going to
applications like it could be portals or ERP systems, or do you see that like is not going to go away just like that? Is going to take some time?
Yeah, it will take some time for sure. But whatever you said is 100% valid. I mean, all these what would be a need for someone to
go in and then update and create and update something? Is that things are getting done, then we'll inform.
If you look at how it evolved, how the digital age evolved, previously we used to used to have most of it used to be desk jobs. We used to sit down, open some portal, input our data and all that. Now you're on the move. If you go to any restaurant or anything, you have your iPad on the table, tablet on the table, you order, the order comes to you.
That's it.
So
there's no need to have system or nothing done. You're right.
Like that, there's been evolution from a desktop to a tablet or a mobile way of
and then,
digital age. Now from mobile it will be AI.
Meta now, so you can you can start ordering or calling through Meta, and then phone calls also possible.
Exactly.
Maybe it will become phoneless, like in the future there won't be any need of phone, any one device which will virtually you can do. So
highly possible.
We can see all the fiction movies are going to come into the reality probably, right? Excellent. Good Arun, really nice talking to you. Good chat. And then we'll have future sessions, and we'll have focused topics we can brainstorm with a couple of our delivery team as well. So it'll be awesome.
That's great. It's
Thanks, Arun.
Good thought-provoking questions. Thank you
so much. Really appreciate it.
Thank you.